Exciting. Hello. Hello. Hope everyone is doing well today. As usual, I like to give an opportunity for everyone to come in, get situated, get settled, get comfortable, grab some snacks. They're on the bar. And as always, we encourage you to say hello. Let us know where you're coming in from. And we will start in exactly just over 90 seconds. This is the part where I pretend I'm busy, doing really important things. This is where oh, Jelly Bean, what's up, you? I don't even see your name anymore. I just think watermelon. That's all. Hi, Diane. Wow, such drama. Hi from where? Where are you from? I don't know. It's just, Hey, Crystal, good to see you. Dallas. Did I tell you I went to SMU for a few minutes? I actually had to drop out of college because of OCD, but I went to SMU in Dallas. I like that. Hello, Dr. S and Ethan and all.
Hello, Jelly
Bean. You did. Okay. Hey, Thomas. What's up? Oh, Schenectady. Nice. Okay. Hi, Diane. Hello, Dottie. Welcome, welcome, welcome. We'll be starting in just about 45 seconds. We're very excited to see you today. Have everyone on. Hey, what up, Sean? Sean Shinnick's on board. Please go to Instagram and go to Draw Your Monster. Check out his work. He's insanely talented and a really awesome OCD advocate and a dear friend of mine coming out of Boston. Our friend from France, Stephanie. How are you, darling? All right, we're coming up on 15 seconds. Get your pens and papers ready. We've got an awesome panel for you today, addressing all the hot topics in entertainment news. Hi from Columbus. What's up, Barbara? All right, we're coming up on 2 minutes, so let's get this party. We should be Texas friends. We are Texas. What Texas friends? What do you mean we should be? Hey, Rachel. All right, so welcome to the Saturday OCD, IOCDF, COVID-19, and OCD Town Hall. My name is Ethan. If you don't know me, I'm the National Ambassador for the International OCD Foundation, which simply means I have OCD, and I like to talk about it way, way too much, especially in these last 6 weeks. Hopefully you are enjoying the content. As always, we are here to support each other. We're all in this together. This is really unique and unprecedented times. And so we like to create as much content as possible to help everyone, including ourselves, frankly. We're all going through this together in an effort to educate, support, reduce stigma, and just do what we can. Today is a really special town hall. I'm really excited about this. As states are starting to open up and we're kind of determining how to move forward through this, whether you're still quarantined in a state that has had higher numbers of COVID-19 to other states like Georgia, which is kind of, people are weird. Oh wait, Josh is in Georgia. Sorry, never mind. I forgot you were here. No, everybody will feel an unusual sense of social anxiety or discomfort, whether you've been home alone in quarantine for 5 or 6 weeks or with family members nervous to get out. So that's what today is about. So we will be opening it up to questions as usual. Feel free to ask any questions that you want, but if you have questions specific around either if you're isolated home alone or you're experiencing anxiety, whether going out now because you need to get groceries or what it's going to be like in the future, and any fears or concerns about that, please feel free to load your questions into the comment box. We'll be talking for a little while and then open it up to Q&A for the duration of the town hall. Just some quick notes. Please be kind to others on the stream. Everybody is here to support each other. Also, this is not a replacement for therapy. If you need therapy or you are in trouble or you're feeling like a danger to yourself or others, please call 911 or the Suicide Prevention Hotline. But otherwise, we are absolutely here to support you and talk about things that you may be able to find beneficial in your life. So I'm really excited to introduce my guest for today. We will start with a frequent guest on the show, Dr. Aureen Wagner, one of our favorite people to have. Dr. Aureen Wagner is an adjunct associate professor of psychiatry at the University of North Carolina, Chapel Hill, director of the Anxiety Wellness Center in Cary, North Carolina, and member of the Scientific and Clinical Advisory Board of the IOCDF. Dr. Wagner specializes in cognitive behavioral therapy for childhood anxiety and OCD, and is the author of Worried No More, Help and Hope for Anxious Children, Up and Down the Worry Hill, a children's book about obsessive compulsive disorder and its treatment. What to do when your child has obsessive compulsive disorder, strategies and solutions, and treatment of OCD in children and adolescents, a professional's kit. I'm detecting a pattern, Dr. Wagner. Thank you so much for being here. We'll now move to Dr. Wagner's, well, depending which way you're facing, to the left or the right. We're excited to have for the first time on the screen, Dr. Josh Spitalnik. He's a clinical psychologist and an anxiety and OCD expert and board certified in behavioral and cognitive psychology. He is the clinical director and the owner of Anxiety Specialist of Atlanta, specializing in cognitive behavioral therapy, evidence-based interventions, and exposure therapy for anxiety disorders among all ages. He is a board member of OCD Georgia, is on the board of local schools, religious institutions, and mental health nonprofit organizations. He trains therapists around the country in his specialties of using exposure and response prevention therapy and CBT to treat anxiety and OCD among children, adolescents, and adults. He is also adjunct assistant professor in psychiatry at Emory University. He's co-authored over 30 publications and treatment manuals, has been a principal investigator for over 10 federally funded research projects with the NIH, CDC, and U.S. Armed Forces. Thank you, Dr. Spitalnik, for coming and being here with us.
Awesome to be here representing Georgia.
Absolutely. I'm quarantined in Atlanta at the moment with the family, so we're too close. We're not probably too far from each other. Last but certainly not least, to my left is a man that is close to my heart. I'll explain that later. The incomparable Dr. Jason Spielman. He's a licensed psychologist in Florida and is the clinical director of Anxiety and OCD Treatment Center of Florida. For 2 decades, Dr. Spielman has helped individuals and families with psychological conditions, specializing in treatment of OCD, ASD, which is autism spectrum disorder, anxiety, panic, tic disorders, and other related conditions. Dr. Spielman is a graduate of the IOCDF BTTI, has primary and advanced training certifications in REBT, CBT from the Albert Ellis Institute, is the president of the board chapter of the Florida Psychological Association, is on the board of the OCD Central and South Florida affiliate, and he wrote in here, Ethan's favorite psychologist he has ever met in his entire life is Dr. Spielman. I'm going to call you out for writing that. So little known fact, Dr. Spielman was actually on my treatment team way back in the very beginning when I first found ERP treatment. So we go way back. He knows all the dirty secrets. But at the end of the day, thank you, Dr. Spielman, for being here as well.
Thank you, guys. I'm glad to be with everybody, and it's nice to be able to present and talk and be able to hopefully help everybody in the conversation.
Absolutely. So let's get started. I want to give everybody an opportunity to just sort of make some introductions. And so, Dr. Wagner, how are you doing? What's the latest in your life? What are you seeing and experiencing from an isolation perspective in your own practice and maybe with yourself as well?
Okay. Thanks, Ethan, for the warm welcome, and welcome to my colleagues as well. It's been my pleasure to do these. And today, I guess I want to focus really on the social isolation piece. We've talked about other topics in previous town halls, but I am seeing folks who find themselves living alone. Now, we're all social distancing, so yes, we're all socially disconnected and discombobulated in a lot of ways, but there are people who have found themselves living all by themselves for a variety of reasons. Maybe they had to quarantine, or they were healthcare providers or essential workers who don't want to take it back to their families, college students who got stuck in an apartment and couldn't go home, various things. And I think that they're or young adults working in cities away from their families, and suddenly they're cut off. So they have a bit of a unique situation in the sense that people who live in families or with others at least have real people to talk to on a day-to-day basis, whereas these folks don't. And so I want to particularly address them, but everything I talk about also applies to any kind of social isolation. So when all this first happened, we were all in scramble mode to try to figure out how to keep up and what to do and how are we supposed to rearrange our lives. And we thought, okay, a couple of weeks, we can do this. Now it's 5 weeks, 6 weeks in, and now there's all this uncertainty that's looming large ahead of us. It's not going to be over soon. How much longer? How many weeks? How many months? How are we going to get through this? So I think we've shifted to a different phase of the adjustment now. The reality set in, we're stuck in our homes, and now how do we keep going, correct? And again, I think for people who rely a lot on social support to do well, this is especially hard. But instead of focusing on all the things we cannot do, which it's okay to acknowledge that and to feel the loss and the grief and, accept those feelings as completely normal. But then if we want to not get stuck in what we cannot do, we have to start to shift our focus to what we can do. And so there's research that shows that, engaging in fulfilling activities and enjoyable activities can improve our mood, improve depression. It's called behavioral activation. And I'm proposing a sort of behavioral activation for COVID times, which is adjusted by the constraints of being in the boxes we are right now. And I think it's more important than ever to be proactive, to be deliberate, and to seek to cultivate social relationships and social connections beyond what we used to know how to do before. And so I propose 5 steps. The first is to sit down and think and make a list of the things that are important to you, your goals, your values. What do you think is meaningful in life with regard to friends or family or your job or hobbies or anything, different topics. The second is to make a balanced and meaningful schedule for every day. So have a wake up time and a bedtime and have some blocks of time that you're going to divide between these different activities. And we can get into details later in the discussion. And then the third thing is to populate the schedule with those activities. And now here's where you have to really think out of the box. We're in the box, but we have to think out of the box. And I think one of my colleagues probably have much better ideas about some of the specifics there. So I'll leave that to them. And then stick to the schedule. It's really important to hold yourself accountable. And sometimes if you think you're not going to do such a good job, share it with a friend, share it with a family member and say, okay, this is what I'm going to be doing. And check in with them to make sure you're accountable to your schedule. And then finally, be good to yourself. So these are times when we're going to make mistakes. We're not going to do well. And I think being kind and compassionate to ourselves is important. Treat yourself to something at the end of the day, a cup of tea, a good book, a junky movie, whatever it is. And then I also say, see if you can laugh about something every day. Humor is an excellent coping strategy. Now, of course, the timing is important, but if you haven't noticed, there's a lot of humor going around about the whole COVID-19 situation, and we don't want to be insensitive, but sometimes we need a good laugh. And finally, be grateful. So select at least one thing a day for which you're grateful about. So that's my behavioral activation for COVID times. Focus on what you can rather than what you cannot do.
I love that, Irene. And not to tangent, but quickly, you raised this, so this is wholeheartedly your fault. What is your go-to favorite junkie movie? What has that been so far?
Oh dear.
You. What is it?
I'm not confessing anything. But,
now we really want to know.
Let me say, on the topic of Home Alone, you brought this up, but Home Alone is a great movie.
No, we want the dirt, Dr. Wagner. We want to know what reality show are you? Okay, we'll live with the uncertainty. We'll have to live with the discomfort of not knowing. But I will find out. I promise all of you, we will discover what it is. Okay, thank you, Irene. So, Dr. Spitalnik, so I went out day before yesterday, and I went to the ATM, and it was probably the first time I'd been out in a couple weeks, and I got an overwhelming sense of anxiety. I was also kind of outside my body a bit of I can't believe I have to do this stuff to just go deposit a check. Yeah. So it was I had trouble processing what I had to do with, sanitizers and gloves and masks and all this stuff. And then just the level of anxiety, actually, I found myself frozen at times after I used the ATM because I was like, wait, the card, all the thought process. I mean, give us some insight into sort of the social anxiety ramifications of what's happening and how we move forward from it.
Definitely. First, just want to start and thank you specifically and the International OCD Foundation. We're actually doing it right now, Ethan. So we are all watching people on the side over here supporting each other. And I'm assuming most of these people are strangers to each other. So we are right now watching what Dr. Wagner recommended, people being kind to each other and supporting each other and saying, hey, go to the OCD conference, and hey, have you tried this thing? So even this experience right now is people socially connecting, and it's awesome. So thanks to you for all resources you're putting online and the International OCD Foundation.
Thank you, Josh.
You're right. So OCD does not live by itself, nor do you need to have OCD to be kind of unnerved going outside, whether you're going to the grocery store, whether you're going to the ATM. So whether you've had a lived experience with anxiety or OCD or not, Ethan, I think most of us will walk around being a bit more hypervigilant and aware of our surroundings, who's interacting with us, who's coughing near us. If you go outside and take a walk or take a jog, are they wearing masks? We've seen enough videos recently of, how far a cough can go when you're walking next to someone. So we've seen enough information out there to sort of overwhelm us. But to shift towards the social anxiety component, Dr. Wagner did a really beautiful job just talking about social isolation, and whether you live by yourself or whether we are now sort of contain our own homes, that social anxiety specifically is going to spike right now for anyone who's struggling with social situations, and that I'd be concerned for anyone who is staying more at home, which we're being advised to do, who is finding maybe some comfort staying at home, which we're being advised to do. So as Dr. Wagner highlighted a few really great tips about behavioral activation, I'd recommend that anyone who's struggling specifically with social anxiety, which is really the fear of being evaluated by others, the fear of talking to others, the fear of being negatively critiqued by others, a little bit different, Ethan, than probably what you were referencing at the ATM. But people with social anxiety right now are almost being given a get out of jail free card. And though for them physiologically, that's maybe a good thing, for us as therapists, we don't want that. And so somewhere in between avoiding, because you've been told to avoid, and avoiding, which is what I'm going to recommend people do, is how do you get yourself outside of the confines of your home safely, so you're not exposing yourself to any medical concerns, but to connect with others. And so I think we've all talked in different ways, and professionally, I wrote a blog recently, a long-winded one, about maybe we don't use the concept social distancing, but physical distancing. And so socially anxious people, like the rest of us, are being asked to restrict their activity and restrict who they're interacting with. But I'd really encourage them to physically distance, to be safe, but to socially engage. And to sort of dovetail on some of the things Dr. Wagner talked about, being kind. I think anyone with social anxiety, without us getting into the therapeutic side, which Dr. Spielman, myself, and Dr. Wagner can talk a little bit more about in a few minutes, I think anyone with social anxiety should look at the opportunities for a challenge, and those challenges for positive growth. And I know how difficult it is when someone is anxious to face their fears, to live with uncertainty, to be okay not being okay. These are all taglines that I think all of us share with each other. But the reality is social anxiety is very debilitating. And when you compound that with being asked to stay at home and there's no social interactions, not by choice or by force, that's going to be a very depressing, lonely existence. And so I'd encourage anyone, whether you have lived experience with social anxiety, Ethan, or you specifically don't, to find ways to connect with others, whether it's family members, using Zoom or other platforms to connect with people, going to your local fire station or police station and thanking first responders, thanking anyone that you know is in the medical community. I have family members and friends that are doctors and nurses, and so I want to thank all of them right now for being on the front lines of protecting all of us. And so I'm not going to talk just yet about all the treatment things we could talk about with social anxiety and cognitive behavioral therapy, which we could spend hours talking about, but I'd encourage anyone who is socially struggling right now to extend themselves to a family member, to a loved one, to a medical provider, to a first responder, and say thank you as a starting step to put yourself out there, whether it's over this kind of platform, or if you can safely do it, going to a local fire station and just saying thank you for your service. That would be a great baby step to get a little bit out of your comfort zone, look for a challenge, go towards anxiety, and have some compassion. And I think you can't lose if you use that combination.
I think that's really powerful. I mean, like I'm a broken record when I say this, but early on in my treatment, Dr. Michael Janicki always said the best thing you can do for your OCD and anxiety is help others. Yep. And it's at the foundation of the advocacy that I do. And I love that your approach is similar. It's like, it might be uncomfortable, but even just like not thinking of yourself for a moment and just, acknowledging someone else and supporting someone else really not only helps them, but it helps yourself. And it's just such a powerful thing. As I know, also, Josh is taking on my material, man. Josh, acknowledged everybody supporting everyone else on these streams. And that's what's so amazing is everybody advocates for everyone else. So these opportunities are huge, and it definitely gives purpose, gives routine, boosts in self-confidence, which in turn, the other thing I'll mention, Dr. Spitalnik, is that I don't know why I vacillate between first names and the doctor thing.
I'd really go with Josh. Let's just do Josh for me. I'm cool.
All right, cool, J-Dog. So,
Nice.
So, But no, I also think that was a good point. The anxiety that I felt in terms of like, oh my gosh, what if I get sick is different than the anxiety of social anxiety. In my brain, it was like, well, I was going out and engaging in sort of real life social activities and feeling anxiety, but it's important to differentiate between the two as well.
Agree. I have nothing to say. That was well spoken, and let's get Jason in here.
Yeah.
I think a point actually you just made, Ethan, is that one of the best things about what you just said is that you were willing to go out and do it. Yep. And I think a struggle that people are having is, besides the safety aspect of actually, should I go out and contamination, is when I go out, how far do I push in doing that? Like, how much do I actually engage socially with people? And when I do, where's the like sort of line that I can be where I'm still being safe, yet I'm still working on some social context where I'm interacting with people? And even into that, when you're actually working some type of exposure in or some type of social effort, like how can I go a little bit above and beyond to really challenge social anxiety when I'm in a social space that I know is a little bit dangerous as per the CDC and the rest of the country right now?
It's a great point. So to carry that forward, can you help elaborate on, because we've talked a lot in these town halls about, what's following CDC and WHO guidelines and what's OCD, and try to differentiate that gray area to make value-driven decisions. From a social perspective and re-engaging in society, where are some of those boundaries? And look, I remember when you were treating me, it's like, we did a lot of social anxiety. You would take me to the mall, you would make me apply for jobs at random places. You would make me go to hair salons and tell people that I was a hairstylist and that I was trying to apply for a job. So like, what would be the protocol from sort of moving out of this quarantine, or even getting out of quarantine just to do grocery store bag necessities, but then moving out of it? And is it different from before the pandemic, or are some of the skills and tools the same?
I think it's a little different in that, right now, a lot of things are closed. So you can't go do a lot of those things that we sort of took for granted that we were able to do, that were to a certain extent fun, yet difficult, and things that would be sort of the norm for people to be able to do. But I think the gray area is a really important point. And I think it goes to like, how do we discuss, like Dr. Wagner was saying before, in terms of being in the box? And so we are all in this box, in terms of like a Zoom type of space where we are much safer. And how do you sort of translate social exposures and social efforts to that box outside of like the hi, how are you, normal things? I was saying before we got on, I have 2 kids, and one of them had like a Zoom sleepover party last night. So they organized this by themselves, and they had 3 kids who actually were all on some type of Zoom chat or something like that. And they all were sort of spending the whole night together like that. And they woke up and they were still on Zoom together. But I mean, there's a lot of other facets that are similar to that, like Netflix parties where you can watch movies, with people and stream movies live together. And if you're interested and willing to be able to push yourself and to do exposure-oriented things in a social space, then being able to, on purpose, make mistakes, or make errors, or do things that are seen as like socially awkward would be really helpful in terms of doing this. And you could do it all within the context of a digital space as well.
Mm-hmm. Right.
I think that's fair. Oreen, go ahead, Oreen. You have a thought.
Oh, I just wanted to agree wholeheartedly. Again, we've been put in this box. We're in the box, but now we have to think out of the box. And some of those things are just not going to be possible. We cannot go to the mall, and we cannot go apply for a hairdresser job, Ethan. But nonetheless, there are some creative ways to do things. I'm actually working with a teenager right now with social anxiety. And I said to him, you know what? This might be the perfect opportunity for us to do exposures, right? He's at home, but he has a neighborhood where we're allowed to walk here because, we have some space, fortunately. But he never says hello to the neighbors. Now the neighbors are around in their yards and walking. And so his exposure tasks are to wave without saying anything, and then work it up to saying hi and making eye contact and saying, hello, Mrs. So-and-so, how are you? So there are, again, ways to do this out of the box. And I think it calls on us to be very creative, but sometimes necessity is the mother of invention, they say.
I totally agree with Dr. Wagner. Actually, I don't know if what everybody else thinks, or even in the chat what people think, but in the community I live in, I typically see, half a dozen people out on a regular basis. There are dozens and dozens of people, if not hundreds of people that I'm seeing now everywhere, because people can't go to malls like you're saying. And so the social opportunity is there, as long as you keep safety in check, to be able to challenge yourself and to either meet new people at a distance, be able to talk to people, and put that difficult sensation, which is what we're going to stream towards, that Josh has been talking about, which is ideal to move towards the discomfort a lot of the time. But I think obviously with the context of safety in mind at the same time.
And if you live in a city and you are in a building and you're not allowed to go out because there's too many people too close by, there are people in cities who, if you have a balcony, you go out and stand on your balcony and wave to the folks across the area. Or, if there's a window, you open your window and wave to somebody. It's something, you probably get to know neighbors better than you ever cared to know before.
Go ahead, Josh.
I just wanted to, on the therapeutic side, I know not everyone needs a therapist and not everyone will see a therapist, but the three of us on this call here have probably spent most of our career doing things in the office and outside the office. And it's what we love about our job, the ability to sort of break the box that we live in as a therapy box and go into the community. My office is strategically placed around suburbia and shops and restaurants, so we can go out and go to all those places. Let me tell you how amazing it is that now mainstream teletherapy is happening. I think there are lots of cautionary tales with teletherapy, but all three of us now have the access to meet people in their real environments without having to travel to their real environments. And so, again, not everyone needs a therapist. Not everyone will see a therapist, but we now have the ability, as Jason alluded to, for if someone's going to walk in their neighborhood and I can be on my phone in a very secure platform talking with my client or patient and watching them say, hey, right now, go up to that person and say this thing. We as therapists have the ability to meet our patients in their real world in real time. And so, unfortunately, COVID has made all of us modify how we engage with the people that we care for, but it's also increased our ability to get people into real situations in a real place that I just think is fantastic for how we advance therapy and do what all of us do, which is exposure-based practices, in doing so not in our incubator or in our laboratory, but truly in real world. So agnostic to OCD, social anxiety, separation anxiety. I see a lot of kids with selective mutism. We've been given this odd capability now and have been encouraged to push the limits, as Oreen mentioned, the mother of invention. We are being forced to meet people in their real world. And most of us have been doing this for most of our career, but other therapists are getting the chance to do so. So it's my hope that more therapists take chances, also get good training to learn how to connect with their clients, their patients in the real world and meet their needs there. I just think that's a fantastic sort of innovation of where things are right now.
Yeah, there's a lot of what I've been clinicians is not only that, but there's so much insight to be gained by just being able to see where people are in their spaces, in their own environments, and the information that you can gather to help support. I think it's really interesting. If you're just tuning us, if you're just tuning in, I was thinking about tuna fish now for some reason. If you're just tuning in, this town hall is on social anxiety and isolation. We're sort of either dealing and coping with the isolation of quarantine, as well as how to engage back into real life. And maybe, both Josh, all three of our panelists have spoken about sort of really creative incremental steps we can take from isolation to back to society, where it doesn't have to be this all or nothing approach where we've been completely isolated, then we'd have to jump back into a crowd of thousands. And so I think, so if you have questions, start loading them in the comment box. We'll be happy to answer any and all questions regarding. We will get to them in 1 second, but go ahead and start asking. So Josh, and I'll open this everywhere, but I'll start with Josh. So I think it's important, and we talked a little bit about this, but how important is it to define and the distinction and the difference between social distancing and physical distancing? How unhealthy is it to tell people that we need to socially distance versus physical distance?
So there is enough research out there to show that social isolation leads to depression, the co-occurrence of social anxiety and depression. There have been enough studies out there to show that. So I understand the very beginning of all this, those first few weeks, we all sort of hunkered down and figured out, let's all just stay in our homes. And that was what I described as both social and physical distancing. Now I think most of us are trying to figure out, how do we continue to physically distance, literally not shake hands, not be in physical touch with people, but be around them. And I'm seeing a few people comment here of people are afraid to go to the grocery store because just too many people there. I think it's important for people to slowly start navigating their way into the real world. All three of us here have kids. All three of the doctors here have kids. I know mine and Jason's a little bit younger. And though I've gone to grocery stores and I've gone to other places to bring back, supplies and food, my kids haven't. And so let me tell you how weird it is and how creepy it is to go to said grocery store and see people with masks and gloves on. And I'll be interested to see how our kids respond to that and handle that when we start having them go out there. I don't imagine gloves and face masks are going to go anytime soon. But Ethan, your point of the difference between physical and social distance, I think we as a community or as a collective country should really start figuring out how do we start continuing to physically distance, but concurrently encroach each other more, connect with each other more, talk with each other more, not just in virtual meetings, but on the sidewalks, potentially in schools, potentially in clinics, potentially in doctors' offices. And how do we safely do that? And of course, we're all going to look for, healthcare standards of the best way to physically stay safe. But all of us are going to have to renegotiate that connection with each other. I presume all three of us, Dr. Spielman, Dr. Wagner, and I, when we meet someone in our waiting rooms, shake their hands. And in my office, I have buttons that people press to tell the doctors that you're here. I've got to get rid of all that. I've got to get rid of the buttons because I assume people are not going to touch them. And I don't know if I'm going to be even allowed to, whether I want to or not. I'd like to give people hugs. I don't know if I'm even going to be allowed to shake my clients' or patients' hands moving forward. So I think each of us are going to have to personally renegotiate what we feel comfortable doing and not judge other people. I know there's going to be lots of questions about, like, my state, and my governor was the first one to say, let's start opening up businesses. And most of the citizens were not in favor of that. And so legislature and government said, let's do it. But the community said, hold on one second. And so I think each person and each family is going to have to take their own accountability. And to be fair, to not judge other people for what they do, certain businesses need to open up and certain people need to go back to the office. And I'm concerned that we start, challenging each other on people no longer social distancing. So I'd encourage each person to figure out what is safe for them, what they think they can handle. And yes, we're going to start continuing to physically distance, but socially encroach others. And I think it's going to be an individual experience because I don't think any standard or regulation is going to impose or regulate that.
Dr. Wagner, how important is it to not only remain flexible with your own rules about what you need to do to stay safe, but as Dr. Spitalnik was touching on, and we've talked about this before, there's a lot of shaming going on social media, within families. I know that I've yelled at my mother multiple times for, going to the grocery store too many times or whatever. How important is it to remain flexible with other people? And it also comes down to accepting what you can and can't control. But how important is it to remain flexible with our neighbors?
Very important. What choice do you have? You can't control them. So I agree with, Josh and with you that each person has to define their space. And, when we see other people who seem to be doing things differently than we would, like some people, wow, I can't believe they're doing that, and I wouldn't dare to do that. I think it reflects the fact that people have different thresholds of anxiety. And if you are, prone to OCD or an anxiety disorder, your threshold for danger is much lower than that of other people. And then there are, anxiety is on a continuum from 0 to 100. So there are people with very little anxiety. And they don't see the danger and the threat, and they look at the probabilities and they say, okay, yeah, there's some danger, but it's a very low probability. So I think the big thing is we can't get in other people's minds. We can't do mind reading. So let's just focus on what we can do and what we control and give people some space. You're right, Josh. I think when we go back to our offices, people will come in with different thresholds about whether they'll push the button and shake our hands and, bring their own pens to the office and stuff. And I think I would personally be respectful of that and say everyone needs to work in a space that's reasonable for them until we get back to more semblance of normality.
Yeah, absolutely, Irene. That's great. And again, we have lots of people in the room. Please feel free to ask questions. I'll keep asking questions. We have a few questions, and I'm glad you guys are enjoying the conversation as well as conversing amongst yourselves and continuing to advocate. So thank you. But we are here for you as well. So feel free to ask questions. Dr. Spielman, how important is it to almost incorporate proactively addressing social anxiety, again, creatively in your box, so that when you go back out into the world, you're not flooded. How important is that?
I mean, I think it depends on what your values are right now. If your value system is such that this is something that's important for me to do, and my mental health is something that's important for me to be mindful of and work on, and I want to continue to move towards that, then I'd say it's great to be able to do. And I think that people's values shift in times that are more stressful and otherwise. But I think if you can sort of harken back to things that are important for you to work on, that'd be great. I think if you plan them out ahead of time and make, like we're all accustomed to, a hierarchy with some type of list from easiest to most difficult, you can usually spell that out and make some type of organized list. And I would challenge everybody who's being able to work on that. The list might be a little different right now, like Dr. Wagner was saying, and the in the box list might be a little bit more interesting. I know right now social media, as everybody's sort of streaming live right now with us, I would challenge everybody to have some type of social media challenge, to join some type of group, a new group that you haven't been part of before. I actually, a few days ago, joined, which I have never been part of before, like a pinball group. I'm interested in pinball machines. I used to have one, which I don't anymore. And actually being able to like comment on something, get involved in any type of conversation, speaking to people about a topic I don't really know much about at all. And it challenges like that discomfort. And it sort of just keeps things new and fresh and like engaged in terms of something different that you could do. And I'd love to find out if other people are challenging themselves in that type of way, because social media is a more safer space right now that we can be part of versus the gray area, like Ethan, you were saying, going out to a ATM or otherwise.
Mm-hmm.
Josh, is there any way to avoid the discomfort that will come with reopening and moving out of these situations and back into some sense of normalcy?
My answer is going to be very direct. I hope not. And Jason and Ori know what I'm talking about. I don't want people to avoid discomfort. I don't want them to be so overwhelmed by discomfort, and I sure as heck don't want anything negative or catastrophic to happen. But discomfort and pain is a normal process. Any negative reaction we have within our body is a normal process. It's not a fun process, but I want people to be okay staying with discomfort, and then what they do next is the most important decision. Jason has multiple times mentioned this concept of purpose or intention, and I love that. The intentionality of staying with discomfort, which is both an exposure concept and an act concept, is a skill. The intentionality of going towards discomfort, of going towards things that are scary but not dangerous. Ethan, anyone who can do that, again, emphasizing scary but not dangerous, anyone who can master that skill, they could be doing our jobs for us. I mean, that is the ultimate job of all of us during coronavirus, during a transition to college, asking someone on a date. How do you stay present in the presence of discomfort and still move forward with intentionality of things that you want? Whether it's things you want out of joy, out of a job, out of functionality, whatever it is that you want, that's hopefully something positive. Ultimately, that's, I think, what all of us on this group here would recommend is, how do you move towards discomfort and stay present in that discomfort, but take action, as Oreen listed many actions to take that give you purpose and control. And at the end of the day, that's what we have. And I'd encourage anyone to run away from discomfort and think that becomes a solution. In fact, Fred Penzel has written some really great stuff out there about how to manage and treat OCD. And one of my favorite lines that he wrote was, anxiety is not the problem, addressing the compulsions is. And so how do we be okay with anxiety, but not give into either rituals, safety behaviors, or compulsions, whatever label you use for the things that we do that we think we need to do to run away from discomfort. And so I would encourage anyone who is facing discomfort in a safe situation to go towards it, with a friend or not, and do something you actually want to do. And to be able to co-occur or hold both those in your hand at the same time, that's the magic.
Irene, do you have anything to add?
Sure. I think those are excellent points by both Jason and Josh. And I would say that what we need to consider is our anxiety reasonable to the context or excessive? That's the hallmark of an anxiety disorder, really. Anxiety is normal. We all have it. And I think these days, with everything that the COVID has created in our world, everyone's experienced more anxiety because there's a lot of unknown and there's some potential danger. But as we anticipate reintegrating back into our old lives, I think a lot of people with OCD or anxiety might kind of lose track of where's that threshold. Now, should I be less anxious about this, or should I still be just as anxious? That might be difficult for people with anxiety. So I recommend that you think about 2 people in your lives, at least 2, that you would call benchmark people. And I routinely recommend this in my practice. Pick 2 people, a family member or a colleague, who are typical in their anxiety. They're not like risk takers or thrill seekers, but they're just kind of your typical folk, right? And if you know them well enough, you can ask yourself, okay, what would my colleague Joe think about this situation? How would he handle it? Or how would my Aunt Mary respond in this situation? Okay, so that helps you calibrate if you feel like you're losing track, you don't know what's too much anymore, it's helpful to calibrate like that. Okay, and as we go back, a lot will keep changing, right? Like even we are, I'm avoiding the grocery store and I'm washing my hands if I go out someplace. But at some point, I'll be able to go back to those things. Whereas people with anxiety and OCD might have a harder time figuring out, is it okay to go back and how far do I go back?
Yeah.
Absolutely. I was going to, and then this is the last question I'll ask, and then we'll get to your question. So again, welcome if you're just joining us, and please ask as many questions as you like. In 1 second, we will go through and answer as many as we can get to. Stephanie, also in France, I hear you, I see you, I will answer your emails, I promise. Big shout out. Thank you for tuning in. I'm behind on emails. I'm sorry, guys, I just am, but I will get to them. I promise I will answer your emails. So Jason, this brings up a good point, and this is something that I thought about as Josh was talking about. I love this idea of defining what's scary and what's dangerous. And immediately my OCD brain goes from a lived experience perspective, and especially when I was really suffering, well, everything that was scary I thought was dangerous, because that's what anxiety is, a perceived threat, whether that threat is real or not. So I love the idea of benchmarks, but how can we continue to have insight in those moments and be able to recognize, hey, I'm having anxiety, so this is scary, but I can also acknowledge that scary doesn't always mean that something is dangerous and that I can move toward it anyway. What's a good way what are some skills and tools I can use in those moments?
I think there is a very big difference, and that's a long question, but I'll try to sort of simplify. But I think
you have 2 minutes.
Okay, no pressure. So I think that's a great question, Ethan. I think there's a huge difference between something that's scary and uncomfortable versus something that you can choose to do that would be helpful for you overall. It might be scary to go to a dentist because there might be some discomfort with it, or you can get drill or things like that. But I know it's healthy for me to do it, and I know that I'm going to sit with that discomfort and choose to move towards that because it's a value of mine, and health is a value. So I typically orient back to what are the values that I'm trying to move towards. And if it's something that's value oriented for me in my life, then I'd say, okay, it might be scary, it might be like uncomfortable, like Josh was saying, but I definitely would not shy away from it because I'm uncomfortable with it, or because it might be something that will cause distress with me. Now, I would sort of vacillate on how much distress am I willing and able to have at the time. And if my level is pretty low, like going to the gym, I'm going to start off with a much lower weight, than a much heavier weight with certain things. And if I go to a gym and I lift much, much heavier weights, it could be too overwhelming and I won't be able to move the weight, or I can hurt myself. So I think being able to gauge, and you're your best sort of estimator in terms of how much you can gauge to that discomfort and that pressure. And sometimes though, like you were alluding to, Ethan, people have a hard time estimating what they can and can't do. I think in the throes of where you were at, that you personally were going through, I think that it was hard to estimate those things. And sometimes you needed support, and a lot of people need support in terms of sort of being able to determine how much can I handle? Where is the line that I can be okay with? And like, Josh was saying, being able to work with somebody or going outside with somebody and pointing out, hey, are you willing to try that? And sort of gauging on a person's willingness to make that effort and to try.
And above all, you don't have to do it alone. There's support systems in place, whether there's benchmark, whether you have a clinician, whether you can search out resources and other clinicians, individual peer support groups, peer support specialists. You do not have to do this alone. And, as always, you can go to a variety of websites to seek out resources that may be able to support you in just this quest and endeavor. Let's get to some questions. What do we say? I think this is Jelly Bean. We love Jelly. I think her favorite flavor is watermelon. I asked her that early on. She was willing to answer that, Dr. Wagner, unlike you and your question about movies. Not that I'm shaming you or anything, but anyway, so I'll just pull this up real quick because I think this is a common concern. It's not a question, but it's like, I'm worried when this is over that I'm going to have a hard time leaving the house if my OCD regresses. And so, the first thing I think of when I read this is anticipatory anxiety. And then I think about all the things that we've just talked about and how to sort of mitigate some of that, but also have to embrace this idea that there's going to be discomfort, whether we like it or not. But what are your thoughts on certainty around not regressing with OCD now that we've sort of had to kind of fall back and maybe do things that are not necessarily things we would have done before and then moving back out of it? Josh, I'll throw this at you.
Well, you threw the word certainty out, so I'm going to unfortunately crap all over that right now. There is no certainty. We don't want certainty. No certainty. I keep this really short so we can all get a chance to respond to this. I think my first thing I would say is if Jelly Bean or anyone else out there has had success, quarantine or not, navigating anxiety, doing their own exposures, doing ritual or response prevention, doing things that give them purpose and intention. If you've had any success in doing these things at any point, document. I think one of the biggest flaws that people do when they go through any sort of recovery process or treatment process is they don't keep that journal or that library of assets of success. And when we start anticipating anxiety or getting into a dark spiral, that library of assets is crucial to look back upon. So I think one of the most important things that Jelly Bean or anyone else can do right now is spend some quiet time documenting the things that you've done that have worked for you, whether it's going to a therapist or taking your medication or trying to touch something you normally don't want to touch or reaching out to someone, whatever those tasks are that bring a little bit of anxiety but a lot more success in your life, remember those, because when you start struggling, you can do those exact same things again and reclaim success.
I think that's a good point. Actually, I wanted to add two things. One is, I in the practice that I run, we have journals that we have people keep throughout everything. So all the pamphlets, information, all those things. So I think those are helpful. But I think one thing really to remember is just because there's a quarantine or not a quarantine or whatever it is, you still have specific skills either that you've learned, used in the past, or worked on. And all those skills are still valid. They're still there. I think it's just the recognition that, okay, I have these, I've used them before, and I'm going to choose now to use them, maybe in a little bit of a different context and maybe in a different way and a different speed, but I still have these abilities right now, and they don't just go away because of the quarantine or otherwise. And there's still skills that you could do today if you choose to.
That's a great point. Yeah, no, you didn't answer the movie question, so no.
But nonetheless, you made a point, Ethan, that that's anticipatory anxiety. The thought of going out and re-engaging the world definitely creates anticipatory anxiety. So I would say to that, expect it. Of course, you're going to have anticipatory anxiety. But now, what does anticipatory anxiety make people want to do? It makes them want to retreat and avoid and escape. But exposure, the whole point of exposure is that you do it in spite of your anxiety. So I would say to you, expect the anxiety and then tell yourself you're going to take that action, which you've planned out ahead of time. If you make a plan ahead of time, a systematic stepwise plan, you're going to just do it regardless of how you feel. The feelings are less important than the action. That's what exposure is about.
Thank you, Irene. Go ahead, Josh, do you have something to add?
I was going to say, I love the phrase, if you fail to plan, you've planned to fail. Irene just nailed it. If you don't have some sort of plan in place, I'm sorry, the best skilled person in the world isn't going to know what to do in that moment when they're really overwhelmed. And we can all improvise, but having a plan in place in a rational, calm moment is really a nice way to start moving forward, knowing that there might be some dark times ahead.
Absolutely. Thank you. I just want to say hi to Nikki in Dublin. I always say hi to her. And maybe it should stop. Is it becoming a compulsion? It may be. I don't know. I feel like I always have to say hi to her in Dublin now. So maybe next time I will not say hi to you, Nikki. But hi, Nikki. I'm debating on whether to oh, screw it. So she has social anxiety, so I thought I'd go ahead and bring her question up with love and affection for you. But I think this brings out a good point. So Ashley wrote, I have social anxiety and avoided a phone call yesterday with someone I haven't talked to in a long time. I feel called out, and it is funny. But I will say, how important is it? Let me rephrase that. How Are small avoidances dangerous, or can they build over time and create a much bigger problem? Dr. Spielman.
I mean, I think you said it very eloquently just now. I think anything that you leave unchecked, can sort of build over time and create a larger issue. But it depends. It depends on the person altogether. Sometimes you could have little things and they just are there and they build and they're not an issue. But sometimes, given if the context is that it affects other things socially, your work, family relationships, a lot of other things, it can build and sort of be this cooker, and it sort of can explode and make things very difficult. But I would be very excited to hear if that phone call that was avoided yesterday, did it cause more distress after avoiding it? And like what happened in the context after that? Were we saying, hey, this is like sort of stinks that I didn't make this call and I didn't have this social connection? Or, hey, this was uncomfortable and now I'm going to move towards it and I'm going to work on being able to challenge myself to do that. So I always would challenge people to be able to do things when it's uncomfortable, like my two other colleagues were saying.
And I also want to give Ashley a shout out for asking the question here in a very social situation and allowing me to, we didn't have much choice, but allowing me to call it out and raise it, because you bring up a very good question. What I've noticed just in general is that, you give OCD an inch, it takes 10 miles. Yep. It just does. I call it a can of worms. You open it just slightly, so many worms come out. But if you use the skills and tools whenever those thoughts pop out and just refuse to compulse, then it quiets down really, really fast. It's kind of like losing and gaining weight. It's really easy for me to gain weight. It's much harder for me to lose weight. So, so this kind of touches on avoidance. This is a comment, but I think this goes to, hi, Michelle, first of all, thank you for tuning in. So headed to Walmart for groceries right now with my mask. My concern is there are too many people out right now. So, again, we're in a gray area between what's safe and what's avoidance and what is a challenge, what's scary and what's dangerous. I think I would look at that and go, so in this situation, it's a personal decision. I get it. But like, what's a healthy way that she could navigate this and sort of have maybe a series of questions or benchmarks that he can ask herself as to whether she can ascertain what's moving toward her values and what's moving away from her values in this case. Irene?
Sure. Once again, we can't control what other people are doing. So yes, we may go out and then there's too many people who aren't following the rules. And I think the best you can do is to make sure you know what the health guidelines are from trusted health professionals. I would suggest you make a list of them, you type them up, you write them down. What are they saying about how far you should be from someone? What are they saying about wearing masks? What are they saying about how much you should wash your hands? What should you do with your groceries when you bring them home? How do you clean yourself when you get home? I don't know the answers to all that, but I'm saying each person needs to make a list of those. And then if you type them up and keep them handy, when you come home and you're anxious or when you're in that car or in that store, maybe look at your list and tell yourself, okay, I got to stay within those guidelines. Everything else is too much anxiety right now. And I've just got to tolerate being uncomfortable and getting through it, knowing that I am following the health guidelines.
That's great. And actually, she just commented later on that she just went grocery shopping with a big exclamation mark afterwards.
Yay,
so
Michelle.
We're assuming that's a positive exclamation mark. This is a great question from Jessica. I will leave this up. It's a big one, so we're going to lose Irene and Josh for just a second. There you go. Sit up. I will leave it up just in time to read it, and then I'll drop it out. But Jessica says, my brain is struggling to de-escalate after exposures, exiting my apartment because we don't know the actual risks. In other words, I can't check the facts because we are still learning about the virus. What sort of advice are you giving to clients who were already doing exposure work to leave the house pre-pandemic and now have this? We've been seeing a lot of these questions throughout this process, and I think there are a lot of clues in her question as to maybe some judgment calls that she's already making that may or may not be accurate. Josh, what are your thoughts on this question?
Well, I just think within the question, the concept of actual risks is what I jumped onto right away. Again, my clinician brain is reading it. And I think whenever we do an exposure, our job is to find ways to mitigate as much very real risk as possible. So it sounds like, first of all, she's doing her own exposures. That's awesome. Kudos to her. And I want to go back to persons. Ashley went in a public forum and said that she has social anxiety. I think that is the coolest thing in the world. anyone who can speak publicly and openly about what they struggle with Ethan, you do the most amazing job in the world. Ashley, awesome job for that. But back to this.
It's an awesome job. Also, I want to give a shout out and kudos. It was really good, especially saying, hey, I didn't do what I wanted to a day ago, and now you're going to push to do this.
It's the antithesis of social anxiety. So we've all dropped phone calls. I'm getting off the wrong topic, but we've all missed phone calls, and I just kudos to her. So, but in this situation, the person was commenting on doing exposures. First of all, I think that's awesome. But the concept of doing exposures and really trying to identify that actual risk, I think there's a flaw in that logic. I think all three of us, all three therapists here talk about when you do exposures, focusing on actual risk is like talking about probability versus possibility. And most of us don't like to go in the probability realm. We just go to the possibility realm. It's a possibility that you're going to get AIDS, that you're going to die, that you're going to mess something up, that God might punish you. I can go down the list of all the themes in OCD, but there's a possibility that something bad might happen. And I think Aureen laid out some really nice ways to sort of figure out, like, how do you benchmark that? Who do you use as your checks and balances? And I think anyone doing exposure should focus less on the actual risks and focus on what Jason's referred to. What do you want? What are your choices? What are your values? And if you can go towards discomfort and align that with doing things that you want, I'd put those actual risks to the side and forge ahead.
That's great. Aureen or Jason, anything to add?
No. Well said.
Yeah,
it is well said. And I also picked up on, and Jason spoke to this, where you said, we're still learning things about the virus. And so we don't have all the answers. And I think that, and if Aureen or Jason want to weigh in on this, but we've talked about it a lot in previous town halls, which is, no, we don't. And we could spend a lot of time trying to wait for all the answers or ascertain. It really comes down to either that right feeling or that perfect moment that's time to emerge from our cocoons. But at the end of the day, and I'm just repeating what all of you have said over the last 8 town halls, is that, at the end of the day, we have to continue to follow our values and just accept and embrace what we are being told, what we do know, and do the best we can with that information.
Which is terrifying.
It's very terrifying.
For everybody.
But it's a choice. It's a choice that we can either say, I know something is scary, and I'm going to choose to be in that space of scariness to a certain extent, or I know something's scary, and I'm just going to sit, avoid, and do very little. And the balance of that is very, very difficult, because scary things are a lot of the time, for a lot of people, not preferred. But if you think about it in like a little bit of a different model, like scary movies or horror films or things like that, do very, very well in movie theaters, and you wonder why that is. They make hundreds of millions, if not billions of dollars on a normal non-pandemic year, because people typically like that feeling. They like the sort of uncomfortable, I'm in a space where I don't know type of thing. Well, there's a lot of people, Ethan, who do like that, right? Because they go to these movies. But I think one of the main things is they're able to view it differently than other people who are uncomfortable in those situations. So the way you view discomfort and how you're able to have that space where you can view something as very uncomfortable, like fast heartbeat and all the physiological discomfort that we have, versus people who view that discomfort as, oh my God, that's horrible, and I'm not moving towards that, is a really important point to make, for people who are working on this.
I agree. And I also think, we really have to acknowledge that the uncertainty hasn't particularly changed from before. I mean, I can make the argument that, well, I don't know if a car is going to hit me. I want to wait till all cars are equipped with technology that can stop before they hit me, or there's 80 kinds of strains of flu. How do I know which strain is this year? And do the doctors really know? And I'm going to avoid it. And the fact of the matter is, and the point I'm kind of making with all of that is our OCD really going to be satisfied when they come out and they go, we know everything about COVID-19. Yeah. We know exactly how this works, and we got a handle on it. Is our OCD going to go like, great, I feel good about this? Or is it going to go, no, what if you don't? So Josh, something to add on that? Or?
Oh, I'm just admiring your observation of even when we find out that the silver bullet has been solved and we have all the vaccines, we all are probably realizing that it could morph again, or it could be another, whatever the next flu pandemic or epidemic could be in the next few years. So the reality is there is no final moment. And you mentioned, Ethan, sort of that just right feeling. We all want to get some clarity. We all want to get some closure. We all want to get back to work and get our kids back into school. And we all want to sort of feel some sense of normalcy. But at the end of the day, we are surrounded by a lot of information that's scary. And I think we've each on this panel talked about, you've got to do what you think is best for you. Don't be overly judgmental of others. Take appropriate precautions and go towards things that you want. And when we find new information tomorrow, that information is going to change a day from now and a day from now. I think we all just heard in the last few days that you don't have to wash your groceries anymore. And 2 weeks ago, everyone had videos of scrubbing their groceries. So that's all been gone. A few weeks ago, no one was talking about masks. And now we're all wearing masks. So the information is going to keep changing. The perceived and real threats are going to keep changing. What doesn't have to change is people's willingness to face discomfort, do it not alone but together, and do things that you actually take pleasure and joy in. And if you do that, I think we're all winning more than losing this battle.
Absolutely.
I think one way in which all of this really messes us up, especially people with OCD, is that OCD is all about rules. Rules for rituals, rules for compulsions. Do it exactly this way, that way, perfect, just right, correct? And this whole situation is constantly evolving. We don't even have time to figure out, okay, what am I doing today before the rules have changed again tomorrow? So that is what's, I think, really, upsetting to people, is that you can't even define what are those things I need to do exactly. In that sense, it's a wonderful exposure that life is uncontrollable, unpredictable, unfamiliar, uncertain. It taps all those elements right now. And what are we going to do? We have to face that fear, deal with it.
Absolutely. And I think first of all, ask a question. I don't want to cover up Dr. Wagner and Dr. Spitalnik, but she just talks about, she's afraid she'll go overboard when this opens up and then get overly anxious again. And this again speaks to this, and she has any suggestions. And again, this speaks to this idea that there's a one-size-fits-all perfect way to do this whole thing. And there's no manual, there's no guide. It's the first time for all of us. And there is an element of trial and error, and it's not super comfortable at all. But it's sort of the reality that we kind of have to face. So,
well, I don't know if I read one comment along the way. I don't know if it's part of this question that also said.
I can give it up if you like, just to see. As an expert in relational anxiety, I know I'm going to struggle with finding the line between the CDC guidelines and what is actually safe.
Okay.
I'm afraid I'll go. Yeah.
So someone else also said, how do I get to the point of feeling comfortable going out? So I'll piggyback those two. And that's the whole point. You're not going to feel comfortable. Expect to not be comfortable and do it in spite of that. So yes, you won't feel comfortable. You will feel anxious. Expect that. But you just have to make behavioral goals and then just do them. And part of exposure is being willing to be uncomfortable. If you're going with the expectation that, okay, I'll go do it, as long as I'm not uncomfortable, then that's defeating the whole purpose of exposure.
And I think along with that, if I can, I totally agree with what Dr. Wagner is saying. And I think that not feeling comfortable is key, but it's actually choosing to shift how you view it. So if you could shift your mindset and be able to say, this is actually what I'm going out to the store, to whatever it is, to get groceries, but also to choose to be in a situation that I know is going to be uncomfortable. And I'm formally making that choice to be in that space. And I know it's going to be uncomfortable. And like I was alluding to before, okay, this might be for me, my hierarchy or my SUDS level, a 1 or a 2 or a 3. And I'm okay with starting off in that point. But I'm going to choose formally to be in that uncomfortable space. And maybe I don't choose a 7 or an 8 or a 9 or a 10 because it's too much at the time.
What is the SUDS level, Jason? I'm asking for.
Oh, you're asking me.
No. I was asking for those that may not know the acronym. Yeah.
Sure. It's your subjective unit of discomfort. It's how discomforting something is when you choose to do an exposure or something like that in a space that you're going to try to work on. Usually we rate it from 1 through 10 or 0 through 10, depending on the person. And 1 would be the lower side and 10 would be the higher side.
This is a great, thank you. I appreciate that. This is a great question. It's not a question per se, but I think it follows up nicely to the ERP. Sorry, Irene and Jason, Josh, we have to figure this out. But I'll just read this quickly. My current struggle, she was talking about what to work in a retirement community while having OCD anxiety. What if I bring it there? What if I bring something home? Just the danger tape that plays 24/7, but I continue to do it and work through the discomfort. So that's awesome, but it does bring up a question, which is, and this is a question we get a lot of times, is what's the difference between working through the discomfort and kind of white knuckling it, as we call it, or gritting the teeth, and really embracing the discomfort and literally seeing a shift from that danger tape playing and I don't know what Sherry is doing, so I don't want to comment on her, but I know for myself, I would kind of just grit it grin and bear it through the exposures, and the fear and anxiety would stay the same. But when I started to really embrace this idea of the fears and the thoughts and the feelings, that's when things started to shift. So how important is that, Josh?
Yeah, so when I train other clinicians in ERP and I work with the people I work with, I make a big distinction between intended exposures. Jason has come back to it multiple times, which I really do love. This purpose, this intention, like intentionally choosing it, intended exposures, and accidentally getting exposed. And I think right now, lived experience or not, we are all being exposed to a lot of cataclysmic anxiety. That's different than intentionally doing something that creates anxiety with the purpose of experiencing anxiety, with the purpose of then learning from that experience. And so as you, Ethan, kind of said, I'm choosing to white knuckle it. That seems to be an oxymoron to me. It's either you're going to choose to experience anxiety or not. And so I think anyone who chooses deliberately to do something that's difficult should take inventory of that, should give themselves a lot of recognition and appreciate that, congratulate themselves, but also make meaning of it afterwards. And so there's a big difference between just being surrounded by things that make me anxious and white knuckling it and getting through it, which most of us are doing, versus intentionally doing something that I know is going to make me anxious. And I'm choosing to do it for these 3 reasons. I want it for this and this and this. I'm fighting for my family. I'm fighting for my pension. I'm fighting to prove that anxiety is not going to take me down. And when I'm done doing that fight, I'm then going to process, which we all talk about emotional processing or lessons learned. I'm going to make meaning out of what I just did. So the next time I'm faced with an accidental moment of anxiety, am I going to accidentally white knuckle it? Or am I going to effortfully go towards that anxiety with intention to fight it, to stay with it, and to do it again and again and again? So I just like to make that distinction between what I describe as intentional exposures and accidental or life experiences. And I think some people say, I'm exposed all day long. What are you talking about exposure therapy? Well, you're being exposed to it all day long, but you're not choosing to do those kind of things. They're happening to you. And so we talk about mastery and control and going towards that. I think those are key concepts to really own your anxiety, be the boss of your anxiety, and take control of your life.
Okay. And if I may add something to those good points, you might also be thinking, but I keep having these thoughts. What if this happens? What if I bring it home? What if I take it there? So I would say to you, notice those thoughts, acknowledge them, label them, and tell yourself, I notice I'm having these thoughts. And then, like Josh and Jason said, you're choosing to do the exposure regardless, but don't ignore the thoughts or pretend they aren't there, and recognize them as just thoughts. Thoughts come and go, but you are choosing to do actions, purposeful actions, in spite of your thoughts.
And I wanted to clarify, because you hear a lot of people say, look, I keep doing the thing that I'm afraid of every day. I've been doing it for 10 months and I'm still uncomfortable and anxious. Why? I've gone through it. And so it's important that it's not just the action, but the mindset and how we're looking
mindset.
At it.
Yes. The mindset.
I think along with that, if I can, Ethan, one of the other things is that the volume, if you may, of thoughts goes louder and softer a lot of the time, depending on lots of factors. So I think I agree entirely with both what everybody's saying, but I think that being able to recognize that the volume of the thoughts is not always at an 8 or a 9 or a 10. Sometimes it softens and it's like, oh, okay, I know that message or that obsessive thought is there, but it's not like in the forefront of everything, and sometimes it shifts off to the side. A lot of the time I like to say it's almost like you're at a party that has like a loud, movie going on, and you can choose to recognize that movie is there and you're watching, Dr. Wagner's favorite movie that you won't talk about. And it's really loud and it's on, but I could choose to give attention to that movie, or I can choose to recognize it's still there. It's still loud on the side somewhere, but I'm going to still focus on a conversation with somebody else at the party because that's my intention and that's what I'd like to do. And I can't control how loud the movie is, but I can choose to focus on the conversation that I'm having. And eventually the movie sometimes will end or it'll get softer, or sometimes your mind just shifts away from it. And it's important to recognize that intention, I think.
I think that's a great point. And definitely go ahead, Josh.
Just want to add one thing to that. So Maureen jumped on that what if kind of question, that what if thought. This is getting a bit in the weeds here, but for most of us, I believe that what if we would describe as a mental ritual. And someone on this list here, I don't know who Justin F is, but I like Justin F a lot. He made mention that don't forget about the RP part of ERP. We talk so much about exposure therapy, and exposure therapy is something that is ubiquitous across all the anxiety disorders, except mostly GAD. So social anxiety, OCD, specific phobias, post-traumatic stress, you name it. But ritual prevention is such a unique and powerful skill but sometimes I think we do sometimes neglect it or not spend enough time with it. So Ethan, when you said, listen, this person, for 10 months, they're anxious all the time and they're staying with the anxiety, I'd make note of how many things are you doing on a daily basis, and it can be a lot for certain people, that you are undercutting your strength and your power, because those little questions, those are not obsessions, and hopefully I'm not speaking out of turn here, but those are mental rituals. Those are your attempts to clarify and feel better. A few persons asked about the actual risks. Those are ways to make us feel better. So rituals can be both behavioral and mental or cognitive activities. And I'd encourage anyone, whether they're with a therapist or not, to spend time paying attention to all the little things they do. Big ones are easy to see, but the little ones that give them momentary feelings of less anxiety. And if you can rid yourself of those and modify them, that might actually also help with 10 months of I'm chronically anxious. I just wonder, without trying to shame anyone, are you really eliminating all those rituals? And sometimes they're insidious, they're subtle, they're quick, they're hard to identify. And so that's why I love doing it with patients and clients in therapy, but not everyone's going to have a therapist. So ritual prevention is a really powerful tool.
Thank you, Josh. Absolutely. I don't want to pull up Rachel's question because it'll block half of us, but I do want to say, so the gist of it is that she's getting tons of conflicting information. The country says one thing, the federal government says one thing, the state government says another thing, the county says another thing. And she's like, as I want to expose myself and start becoming more social again, she's already feeling on edge about this. Like, who do you listen to, and how do I even begin to start exposing myself when there's so much conflicting information? Who wants to take that? I'll throw it out to the three of you.
Is everybody not making like an Excel PowerPoint presentation that sort of chronographs everything that's being said and done? And I don't think there's a right answer to a lot of that. I mean, I think I follow what the CDC tries to say in terms of what to do, but I think everybody's going to have their own, I should do this. And Josh's state is opening everything and my state is closing everything. But I don't think there's a just right answer. And it could be very overwhelming if you try to analyze all the information all at the same time. And I think everybody has a certain level of comfort of what they're going to do. I think just in the context of being able to be willing to, this is what works for me and this is what's going to make sense for me, while not trying to give in to the sort of compulsive urge to have to do 100% of everything all the time.
Yeah. Absolutely.
Again, I think this kind of drives that desire to know what exactly and perfectly to do. And it's really sort of making us anxious about that. Well, this one's saying that and that one's saying that. Now, what is the right thing? I think Jason's making a really good point. Who knows? Who knows, right? And it's changing every day. So I would say, again, tell yourself it's okay to be confused about it. It's okay to feel uncomfortable. Do your best. It doesn't have to be perfect. Think about 2 benchmarks. People you trust. It could be a physician you trust. What would your doctor say in this situation? What would your favorite relative say, or your colleague? And you just kind of have to go with the best, good enough.
I always ask, what would Ethan say?
What would Ethan say?
Exactly.
I'm still trying to answer emails, so don't say that. Just doing the best I can, man.
He's not even listening. He's answering emails.
I'm not even paying attention. I'm actually catching up on Love Is Blind. On Netflix.
Oh no.
Yeah.
Oh no, I'm kidding. I'm actually running the show technically today, so I apologize if I seem a little distracted. So Maria has a question. We did touch on this before, but I think for people that are maybe late and just joining this, Josh, I want to throw this out to you quickly because you had a really, really good answer, which is when things change, we're allowed to be less than 6 feet from people. How do we deal with relearning how to be comfortable being close to people since we spent so much of the past few weeks social distancing? There's one key word in there that you're going to quickly target and nail. Go for it, Josh.
Well, I actually want to jump on. We haven't talked much about kids in this segment today, so I want to actually start there and then let the other colleagues go there. But I think from a kid's perspective, we have now spent at least 30 days. It could be anywhere between 60 to 90 days coming up, having kids socially isolated. Most of us adults are pretty formed and we've done our things and we have routines, but kids are these balls of clay who are learning new things every day. And right now they're learning to be on their own and to socially not engage in, to not use nonverbal communication. I think the person's question is very appropriate. I think it's a real thing to consider, but I want all of us to think about how do we start having our kids right now slowly start engaging with people, as Jason talked about, walking on the sidewalks or going to grocery stores. Like, how do we start having kids start having pretty normal civil interactions with other kids? Because we've got to get that transition happening sooner before they're lumped back into school or lumped back into camp. But I think everyone's going to have their own process by which they go through socially navigating what's appropriate and what's not. I am a hugger and a handshaker and kiss on the cheek kind of guy, and that's all out the window right now. So I don't know how people are going to negotiate that. I think Maureen said everyone's going to have to respect other people's boundaries. So I know what I'm comfortable with, and my family, what my family's comfortable with. But I have a sibling and her husband and her 3 kids that are a stone's throw away from me, and we're not even physically touching each other. We have driveway meals and hangouts, and that's my blood, that's my family, out of respect for what is being done. She's also a nurse and works in a medical clinic, so there's other factors there. And so I think each person, each family is going to have to socially navigate that. But I really want us to think about how we're going to start having kids slowly acclimate back into social engagement, and we might have to reteach them like how to say hello and how to interact, and how to talk to other people.
Irene,
Do you mind posting the question again?
Oh, I do not.
I'm old, I forgot already what exactly it said. Okay, so the phrase that caught my eye was learning how to be comfortable.
Yeah.
Relearning how to be comfortable. Okay, now you can take it off. And again, it comes to that mindset issue. If your goal is to be comfortable, then I think you might be disappointed. I call that, there's a right goal of treatment. The right goal is to choose to be uncomfortable. The wrong goal is to think, I'll do this if I don't feel comfortable. If I don't feel uncomfortable, or if I'm comfortable. Okay, so I would think about your mindset. It will be uncomfortable. It's supposed to be uncomfortable. I can't see how it wouldn't be uncomfortable. And you have to say you're accepting that mindset and you're going to choose to do the action in spite of it.
Thank you, Irene. I do want to give Ashley another shout out because she said, thanks, guys. You all made my day, but I love hearing how we don't have to let anxiety run our life. I always tell myself, breathe into the discomfort and try to sit with it. So you may not have answered the call yesterday, but you're killing it today. And so that's what it's all about. And it's a great, also, we always talk about the importance of compassion and that being okay with ourselves and being willing to make mistakes. And it's okay. Not that avoiding was a call was a mistake, but I'm just saying this is not a perfect science. We can't do this perfectly. We're gonna compulse. We're gonna make mistakes. We're gonna do things, but it's about what you do moving forward that counts.
Okay, can I touch base on what Josh was saying a second ago, Ethan?
Absolutely.
Just some cool things that, from a social perspective, and I'm not sure what all the other people who are on, I'd love to find out, are doing. But kids, what I've been seeing are carrying around chalk and chalking each other's driveways and sidewalks. My kids have been actually drawing lines on the ground that are 6 or 12 feet apart and having play dates where people can be in certain spots and sort of be around each other. They're doing car lines and things like that. So all the teachers at the local school actually drove around maybe about a week ago to all the different houses in the area. It must have been 40 cars or 50 cars, with a parade. Most of the time with birthdays, been doing birthday parades and things like that. There's a DJ who we know who's been doing virtual dance parties and inviting groups and things like that. So the last one we went on to, which would be a great social exposure if something that you'd be uncomfortable doing. And they had I think 30 or 40 people, maybe even 50 on a virtual dance party. And that's a great opportunity for dancing in front of others. But when there's so many people there, if you're trying to work on something like that, or there's so many different opportunities as long as everybody's been saying if you're creative to do, and love to find out what other people have been doing also.
Yeah, that's great. I recently, a couple of weeks ago, I think maybe Dr. Wagner told me about the teddy bear thing in the window. And things. Yeah, so kids can walk down the streets and point out different things and have different treasure hunts and things like that. So it's really, these are all silver linings, that we're kind of discovering amongst ourselves. Rakeem did not ask a question per se, but I think it's important to address because I know a lot of people have been. So I personally struggle with ROCD, which is relationship OCD. I'm not quarantined with my partner. I'm scared a lot of progress will be lost because we can't see each other, but we do FaceTime often. Thank you all so much. So I know this has been a very common concern and fear, whether it was I got my hand washing down to 3 seconds before this, and now I have to do 20 seconds to this kind of thing. What are your thoughts on having to be flexible in this moment of doing what's healthy and safe, but then again, having any regression. Josh, do you want to take this?
Yeah, well, I don't know where Rakeem is on the process of either knowing what ROCD is, although you put it out there, or treatment. But Jason mentioned a really great concept of if you've learned skills, you really can't unlearn them. You can choose not to use them. But once you've had skills to embrace ROCD or embrace the potentiality of your partner leaving you, whether you're in quarantine moment or not, those skills still apply. And so, as I referenced a few minutes ago about ritual prevention, one of the most insidious actions that we can do in an ROC sub-theme is a lot of reassurance seeking to our loved one or to other people around him or her to see if they still love me. And so I would just encourage Rakeem to do his best to stay connected to his partner. If they're in a relationship, I'd encourage him to do as little reassurance seeking as possible, as that can be a real relationship killer. And I'd make sure that Rakeem knows what makes him valuable, what makes him a valuable romantic partner, and why would someone want to be with him and focus on what he can do to maximize being a good person and a good partner. And if that person stays with him, great. And if that person chooses to leave him, hopefully it's because that person wasn't the right person, but not because of what I would describe as rituals or safety behaviors or compulsions. So I encourage Rakeem to live in that uncertainty, to live in that gray space, and be the best version of him, which is a little cheesy and cliche, but it's the reality. I want someone to love me for the best versions of me and not for the things that OCD makes me want to say or do. And so I just wish him and his partner the best if they're in a relationship and then they get through this together.
That's a great point, Josh. I think, and I mean, Jason only taught me one or two good things as a therapist, but that was sarcasm, just in case people didn't pick it up. I don't want to get a call from him later yelling at me. But one of the things I learned very early on is we put a lot of weight behind feelings and thoughts, tons of weight behind feelings and thoughts. Feelings make it true, thoughts make it true, right? And what we know about OCD and other mental conditions and anxiety is feelings are completely irrelevant. They don't matter. In other instances, like love, obviously feelings matter. But I think we put a lot of weight behind that when really, and this goes to Josh's point, is that it's in the response prevention and the actions where we really have control over whether the OCD regresses or not. So we may be having lots of thoughts and feelings, Rakeem, in your case, about like, my OCD thoughts are becoming louder, as Jason said, more present, things like that. But really, it's when you get back out there, your reaction to those thoughts, which will define ultimately whether you move backwards or not. And it's important to, know that distinction that relapse really is in our control based on how we choose to focus and behave once we have the thought or the feeling.
Can I just add, Ethan, that we all have feelings. Feelings are normal. We have good feelings and we have bad feelings. It would be really nice if we could only have the good feelings. Unfortunately, it's not going to happen. And we have to be able to deal with both. But I often tell people, don't dismiss your feelings. Your feelings are real, they're valid, but feelings are not facts. So differentiate feelings from facts. You'll have bad feelings, you won't like them, it's okay. But don't confuse them with the facts. Feelings are not facts. Thoughts are not facts.
Even go ahead, Jason.
That feelings and thoughts are really horrible navigators of directional success. And it just, anytime that I'm going to use a feeling or a thought as something that I'm going to let be my North Star or guide me in a direction, I would say that's probably something I should try to rethink a little bit and sort of go back to the values, goals, and things that I can actually control, the actions that I can control. And I always like to move back towards that.
That's a great point.
I like to teach kids what being a hypocrite can mean when it comes to thoughts and feelings, which can be a very evil concept, but hopefully if you use a little bit of humor, it plays well, where you judge other people objectively by what they say or do. And I think verbal statements out loud are actions to me. So by their actions. But people are not judging you by your thoughts and feelings because they don't know them. So you have to pick and choose. What do you want to do? Are you going to be someone who judges others on their thoughts and feelings that you're not privy to? And if you can do that and you have a crystal ball, that'd be kind of awesome. Or are you going to judge them on their actions? Because they're judging you on your actions. They're not judging you on your thoughts and feelings. So as both people have said, your thoughts and feelings are real, but they just may not be really predictive of what's going to happen next. Your actions are. And so if you're going to judge others on their actions, maybe you give yourself that same courtesy and judge yourself on your intended actions and statements, because ultimately that's what we're all judging each other on. And that's what you have control over.
Yeah. And I totally agree. And thank you, Irene, for the clarification. I was in no way saying that the feelings weren't valid, but using them, as Jason said, as a barometer as to whether move forward toward your values or not.
Understood, yes.
Yeah, no, I appreciate it. I like to learn because the message that I put forth is very important. Unfortunately, we have time for only a couple more questions. I'm going to throw this out at Irene because this is a great question and speaks directly to some of the things that you've been talking about. So I have trouble trusting myself enough to make good calls. I seem to want to trust other people. How can I learn to trust myself? So when you were talking about using other people as barometers, we know that can be very beneficial. But and this also speaks to and I know Josh and Jason will have something to say, the goal of therapy is to be our own therapist, which requires trusting ourselves. So what are your thoughts and maybe suggestions on this, Irene?
Sure. So I would, if I were working with you in my office or via telehealth, if I were talking with you, I would ask you, what does that mean when you say, I want to trust myself? How are you defining that? So I'd want to know a little bit more about what you define as trusting yourself. And again, if it's based on feelings, I have a gut sense that I'm doing the right thing. In fact, I was talking to a client this morning via telehealth, and he said, should I trust my intuitions? And I said, what does that mean, right? So if you're using feelings to believe you're trusting yourself, then your feelings may not match up to the facts or to the reality. So rather, I would have you use more objective indicators about what actions you're choosing to do. You're choosing to do them because there's some kind of objective indicators or your benchmarks are helping you calibrate to that versus, do I trust myself about it? How does it feel inside? Okay. And then I would sort of discount the importance of that trust feeling in the actions you're choosing to make. The choice you make, the decisions, the intentional action that they've spoken about, that's what the more relevant variable is than whether you have the feeling of trust. That's my 2 cents.
That's wonderful. Josh or Jason, anything to add?
I totally agree with Dr. Wagner saying. I think it's a really, really well said and well put point. And I think sort of like the band, ABBA, I'm not sure what it is. The concept of take a chance on me, that song. I think that a lot of these things, especially if you bring it back to social sort of encounters and exposures, socializing is taking a chance. Mm-hmm. All social interactions have a certain chance of either they go really well, they go horribly, or somewhere typically, in between. There is no guarantee. There's no guarantee that any of these things that we're going to try to do are going to work really well or not work well. But I think that if you're willing to have that sort of opportunity to fail versus not fail, it actually brings you along really well. One of my past patients worked really, really hard on the concept of dating and talking to people. And one of the goals was, I want you to go out, and he was trying to meet girls. And the goal is go out, and I want you to try to strike out or sort of fail at least 50 different times, in meeting girls. And he took it as a challenge. I'm going to go and I'm going to try to meet and mess up all the time. And actually, it taught him to be able to be comfortable with that uncomfortable feeling. Mm-hmm. And I would say taking the chance is sort of key and really important in that opportunity.
That's great. That's great. And speaking about meeting girls, just to follow up, unfortunately, we've got to most of the questions, which is awesome. We usually don't. I did want to follow up on Rakeem and just thank you so much. You're absolutely right. Been so focused on the stress and how quarantine will affect the relationship that I'm forgetting to live in the relationship and accept the anxiety, which is awesome. I mean, his point right there is, anxiety exists in the past to the future, and he's just talking about I need to live in the present right now. And that's super important for all of us, and it's hard to do, isn't it?
Mm-hmm.
Can be. Yeah.
Maybe some wrap up thoughts quickly. Josh, why don't you start? Do you have some wrap up thoughts either on Rakeem's statement or anything in general?
Well, first of all, each one of us took major risks by putting ourselves out there today and making some commentary. So I think if you think about this as a microcosm of what we're really asking everyone to do, which is to do something that you love. I know how much Dr. Wagner and Dr. Spielman love doing their jobs as much as I do. I'm doing right now what I love doing, though I'm away from my family right now and they're being very kind to me. I love sharing information about how to beat anxiety, how to manage anxiety, and share with people who want this information. Watching this stuff over here on the panel and seeing people support each other is just, it's mind blowing. It's beautiful. So Ethan, my takeaway from today is no matter what your position is, no matter what things you're struggling with, and whether you even had a lived experience with OCD, social anxiety, or another problem, you don't have to do it alone. There are many actions you can take that are at your disposal. And if you're intentional about them and do them based on things that align with your values, if people like you, great. And if they don't, they don't. But you don't have to second guess, did you put your best person out there? And that's all I'd ask anybody to consider.
And you did put yourself out there, because Patrick McGrath wants you to know that you owe him.
I saw that. So I don't know what money I owe him, but I will follow up with him about that.
So good social anxiety. Dr. Wagner.
Okay, well, gratitude. Let's focus also on thinking about how much we have while we're focused on what we don't have. So right now I can think of one thing to be grateful for is just this community, this online community, right? And think about this topic is about social isolation and social anxiety. So what a great social opportunity we have right here through this. And thanks to Ethan and the IOCDF and everybody that's worked so hard to put this all together. But I can't help thinking to what it must have been like 100 years ago when there was the Spanish flu, or 200 years ago when there was the plague. There was no internet. There was no way for people to communicate. They really were isolated. They really were home alone, right? So we are physically isolated, but not really. You know, Josh's point that social distancing is really only physical at this point. So we have that to be really grateful for. And I want to focus on that we've got so much going for us. And then, remember that movie Home Alone from back then? Go back and watch that movie. It's a good old laugh, you know?
Laughing, yeah, absolutely.
Laugh, enjoy. Find some humor in things. I have to say, I've been so impressed with the humor that's around. I'm amazed at the funny memes and jokes people are coming up with. They're very creative. And I have to say, I'm not that creative or funny, so I have to say I have a lot of admiration for that.
Thank you, Irene. I appreciate that. And we will find out at some point what movie you like. We'll get it
Home
out
Alone,
of you.
Home Alone, Home Alone 2, Home Alone 3. And those are my favorite movies.
Not 2 and 3.
And Dr. Spielman, last thoughts.
No, first, Ethan, thank you so much for all the time, effort, support, caring you give to so many people. I don't know if anybody knows how much time Ethan does put into this, but it's amazing. It really is. And it's really nice to see the feedback and the caring that you give and you get. Thank you so much to the IOCDF and also Dr. Wagner and Spitalnik. It's wonderful to be able to talk and present and see everybody again. And I always think that, we're in a very social world where I think, like Dr. Wagner was saying, we're so interconnected with everybody. It's very different than, even hundreds or, a long, long time ago that we can connect with people. And I saw a really cool thing. It must have been 3 or 4 weeks ago when the first CARE Act came out, where they were giving money to people. And I think they had an acronym, if I remember right, and it had to do with being like CARE, C-A-R-E, being considerate to others, like, and being genuine in social relationships and interacting with people, being like attentive, the A, like being attentive to people in your community, especially people who can't get out and can't go places and do things for themselves. And the R, I think, was respectful. And, because I know that there's a lot of pressure that we have with being with a lot of people, and especially with kids in the family, and all that can be very sort of fire setting and be very difficult. And I think the E was educated. So being really educated about the information that you get, that you have, that you give. And there's no 100% for any of these things. So we try to do the best that we can. And I appreciate everybody checking us out and talking. Thank you so much.
Awesome. Stick around for housekeeping notes. So quickly, I just want to sincerely thank Dr. Wagner, Dr. Spitalnik, and Dr. Spielman for joining us today. This was a really, really great conversation and panel. I also want to say thank you for all the really, really great comments, great feedback on what we're doing. It's been a really positive 90 minutes. And I always urge everyone to please go through and read the comments, because everybody is really doing a great job at answering other people's questions and advocating for themselves and each other and everyone else. Josh pointed it out right away, and it's really a beautiful thing. So definitely some quick housekeeping. So we have a really action-packed week next week. So if you're interested in programming on Monday at 1 p.m., we have a managing hoarding disorder in the time of COVID. So if hoarding is an issue, you won't want to miss that. On Wednesday at 1 p.m., we have BDD in the time of COVID. So if you struggle with body dysmorphic disorder, there's really great panelists along that. So you'll want to tune into that one. At Wednesday at 7 p.m., we will be having a second intrusive thoughts conversation. So we're calling it Coping with Intrusive Thoughts Volume 2. If you were with us last week, it was action-packed, but it was a really, really good. So definitely join us. And finally, on Friday at 1 p.m., we have BFRBs, which is body-focused repetitive behaviors in the time of COVID. So if you struggle with hair pulling or skin picking or any one of those things, you definitely will want to tune into that. Last but not least, a week from today is Saturday. We will be having a town hall, a State of the Union town hall with Jeff Szymanski, the executive director of the IOCDF, board member Liz McIngvale, and the president of the board, Susan Boaz. We'll have lots of information, announcements. You will not want to miss that. As always, I want to thank everyone for the behind the scenes, the IOCDF. I'm actually running it today, so thank you, Ethan, for all the work you did at bringing up the question. You were amazing.
Thank you, Ethan, for all the work you did bringing up.
Extremely good looking. So you're welcome. If you haven't already and you want to be notified about, I'm going to do this. Hold on, I can't do both at the same time. If you, where is it? Okay. All right. So if you want to be notified about all the programming the IOCDF has over the next month, be sure to subscribe to YouTube and Facebook. Hit those subscription buttons. You will get notifications when we go live. Wait, okay, whatever. Anyway, until then, thank you for spending your Saturday afternoon with all of us. As always, you can contact the IOCDF through email or phone call. We are here. They are there. They have a specific person dedicated for resources. You can also go to the website, iocdf.org. We always want to give a big shout out to our partner in this, peaceofmind.com, and Liz McIngvale and all the people there. So check out peaceofmind.com. As always, you can email me at justethan@iocdf.org. I am behind on emails. I'm sorry, Stephanie. I will get back to you. But in the meantime, stay safe, stay vigilant, feel all the feels. Don't let up on your OCD and anxiety. Now is not the time to do that. And thank you so much for joining us. And thank you again to Jason, Irene, and Josh. Have a great weekend. Bye.
Thank you, guys.
Virtual hugs.
Bye, guys.
Yeah, hey.